Hello, this is Dr. Huffman from the Medical Travel Associates. This tutorial is titled, Is Medical Tourism Safe? Medical tourism is when you travel from one location to another for surgery or medical treatment. That doesn't matter if it's 10 miles, 100 miles, 1,000 miles, or 10,000 miles. If you're traveling any distance, you are considered a medical tourism or a medical surgical travel patient. Now, in most cases, you're traveling just within your own community. You're traveling across town or in town, and that's not medical tourism. You're receiving your preoperative, operative, and postoperative care in a facility in your own community. It's when you leave that community. Say you live in Orlando, Florida, and you go to Miami, Florida. That's considered domestic travel. Say you live in Cleveland, Ohio, and you go to Costa Rica. That's international travel. So is this medical tourism safe? And the answer is it can be. It can be just as safe as surgery any other place, but you need to do your due diligence. You need to do a little work and research to discover who's doing the surgery, what are their qualifications, how qualified is the hospital to handle that case. Now, any surgery comes with risk. There are risk and complications with any surgery, risk and benefits. And you take that risk and benefit and weigh that when you make the decision to have surgery, whether that's in your own community or at a distant location. But for most of us here in the States, it's just so much easier to measure that risk benefit when it's in our own community. We know those surgeons in our community. You can ask your primary care physician about that surgeon. They'll have an answer. You know about the reputation of the hospital. But when you travel outside, you're not sure. Even if that's domestically, even if you're traveling from, say, Michigan to California for surgery, you just don't know much about that hospital or that surgeon. Generally feel a little safer traveling domestically. You know, there are certain standards here in the United States that these hospitals are credentialed by Joint Commission. The physicians are generally gone through a credentialing process. They've gone through their medical training and fellowships and residency. So you're fairly confident, but there's still this continuity of care issue that we'll address in a future learning module. And that is when you travel, even if you go to the best hospital in the world, when you come home, you're not near that hospital. What happens if something goes wrong? You've traveled from Detroit to, say, New York, and everything went well in New York, but you're now in Detroit. Complications arise. Who's going to take care of that? So those are the things that you need to answer. And that's even more critical when you travel internationally. If you're going to Mexico or Costa Rica or India for surgery, who's going to take care of you before you go to surgery? What's going to happen there at the surgical center? What happens if there's complications? Who cares for those complications or covers those complications? Do you have any legal recourse if something goes wrong? So those are all things you need to ask. And many folks who travel, they simply go down for the lowest price. They'll look on the internet, find the lowest price for, say, an adjustable gastric band for bariatric surgery or weight loss surgery, and they'll go to the lowest bidder. And that's not a smart move. It's not that the lowest bidder isn't the best. It's just that you need to know more than just cost. You need to know infection rates at the hospital. Is the hospital credentialed to the Joint Commission International? Is a surgeon qualified? Where did he or she get their training? How many cases did they have? What are their complications, their morbidity, mortality rates in a 30-day period? So many individuals, and now insurers and self-employed and or self-insured employers, are beginning to use other third parties, and they're called facilitators. Now, facilitators can help. They can help draw some of this information back and ask questions of the hospital and the surgeons. But in many cases, they're not very well qualified. You have to be careful who you use there. They may be just simply a travel agent that decided to put together a package for you to go to Mexico or Costa Rica or India or Middle East. So we recommend that you get your primary care physician engaged, you ask a lot of questions, and that's where we really specialize. Medical Travel Associates is an organization of physicians. I am a board certified physician. I've been involved with medical tourism for 5 or 6 years now. I actually served as the medical director for the Medical Tourism Association for their physician education. I travel internationally and extensively domestically, talking to physicians, looking at hospitals, vetting out these hospitals, asking those tough questions. What is your complication rates? What are your infection rates? Who's taking care of this patient if a complication arises when they get home? I meet with the surgeons. Sometimes I scrub the cases. I go in the operating room with the surgeon. And my team of physicians and nurses do this worldwide. So what we like to do is, if you're going to have a medical travel, if you're contemplating traveling, call us at 866-270-5116 and let us get involved. What is the cost to you? Nothing. There is no cost to you. We don't tack on any cost to anybody. At this point, we're interested in ensuring that you are getting good, safe, high quality care at a low cost. So we want to talk to your physicians. We want to talk to your hospital. Primarily, we want to talk to your own personal physician, because he or she is so important in the pre-op, pre-travel, post-op, post-travel continuum of care. In one of our next videos, we will discuss this continuum of care and how important that is, because that ensures that you get the best outcomes. So again, if you're contemplating medical tourism or medical travel, contact us at 866-270-5116, and we'll be glad to work with you, your physician, your destination surgeon, your facilitator if you have one, because we want to ensure that you have the best outcomes and you have good surgery at a low and affordable cost. So look forward to some of our further tutorials, particularly the one on continuum of care and how important that is, and give us a call if we can help you. Thank you.